Good day, I'm Theodore Henry, and this is your JIS News for Thursday, February 24, 2022. Government will be spending a total of $5 billion on roadworks in the 2022-2023 fiscal year. This was disclosed by Minister without Portfolio in the Ministry of Economic Growth and Job Creation, Everald Warmington, earlier this week. $300 million is earmarked for emergency work resulting from flooding, $84 million is programmed for gullies, $54 million for bridges, and $74 million to address issues relating to traffic signals.
The resources are limited, but we have tried our best and try our best to use it to the best we can. I'm very satisfied that at least we make some inroad or make some difference in the community.
The minister, who has responsibility for the works portfolio, was touring roadways in and around Montego Bay St. James that have been identified for rehabilitation and drainage upgrade. They include Cornwall Courts, Green Pond, Valley Heights, Capitol Heights, King Street, and North Gully. Mr. Warmington says $10 million each has already been allocated for drainage work in Cornwall Courts and Capitol Heights. Similar projects are to be undertaken in Melbourne Gully and Valley Heights, where box culverts are needed. The National Solid Waste Management Authority, NSWMA, will be receiving an additional 50 compactor trucks to improve garbage collection across the island. $1.8 billion has been budgeted in the 2022-2023 estimates of expenditure to purchase the vehicles under the Acquisition of Compactor Trucks project. The project, which is set to commence in April 2022 and conclude in March 2023, is being funded by the government of Jamaica. It aims to increase the NSWMA's fleet to an acceptable operational level to support work for a cleaner environment. The project is being implemented by the NSWMA, which is an agency under the Ministry of Local Government and Rural Development. The Development Bank of Jamaica (DBJ) will be providing 340 new loan guarantees for micro, small, and medium-sized enterprises (MSMEs) in the upcoming financial year. This arrangement is to be facilitated under the Access to Finance for MSMEs project. $750 million has been allocated in the 2022-2023 estimates of expenditure to undertake this and other activities in support of small businesses. It will also give 15 SMEs access to risk capital through the SME Fund and facilitate an improved voucher program through the use of the new interactive technological platform. Up to December 2021, under the project, 387 MSMEs have been issued with guaranteed loans, and approval of an additional 580 guarantees were supported under the DBJ's Credit Enhancement Facility, CEF.
If your loan needs collateral support, your lenders have pre-approved lines available, and they're able at the click of a button to approve the guarantee along with the loan.
Another $789.7 million has been set aside under the DBJ's Credit Enhancement Program to provide 107 bank guarantees to SMEs during the new financial year. Funding is being provided by the Inter-American Development Bank, IDB. Up to December 2021, 550 bank guarantees were issued to MSMEs under this project. Government will be spending over $2.34 billion in the new fiscal year to advance its prevention and care management of non-communicable diseases (NCDs) program. This seeks to strengthen comprehensive policies for the prevention of NCDs and enhance access to upgraded and integrated systems to improve the health of the population. The funds presented in the 2022-2023 estimates of expenditure will finance several targets over the period. These include the completion of detailed drawings, 3D models, and bills of quantities for 13 health facilities. Procurement of medical equipment for health centers and hospitals will commence. Construction engineer, medical equipment specialist, quantity surveyor, and environmental health specialist consultants will be engaged. The Ministry of Health and Wellness will also be developing and publishing a health app and commencing implementation of managed network services for 105 health centers. And finally, research conducted at the Bustamante Hospital for Children has found that the most common skin conditions among children treated are ringworm in the head, eczema, and allergic reactions to insect bites. Pediatrician and Senior Registrar at the hospital, Dr. Andrew Burton, shared the results of the research project during a recent JIS think tank. The study won him the awards for Best Student Presentation, Most Impactful Poster Presentation, and the Best Overall Poster Presentation at the 2021 National Health Research Conference, adding to the body of dermatological studies in Jamaica and the Caribbean. The data was taken from a sample of clinical records and walk-in visits to the Bustamante Hospital for Children from 2012 to 2016.
It was mostly infants that were seen in the clinic, mostly babies between 0 and 12 months. Infections were the most common thing, and those include fungal infections like ringworm to the hand, the head, the feet. Also bacterial infections that came on top of other lesions that got infected after, or that were primarily bacterial problems, and viral infections as well, infestations like scabies.
Dr. Burton says he hopes his research will lead to increased education in the public and health sector about the skin conditions affecting children.
Knowing the common things will make it more identifiable and can also spark discussion around how to appropriately treat the most common things.
And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.